Good morning, ladies and gentlemen. Mr. Chairman, thank you so much for your kind introduction. I'm a very simple person. I just love to come to interact with local entrepreneurs. And India is so close to Singapore. I'm so glad to be here. And it's my privilege and honor to be together in this Indian Technology Congress. I would like to share with you on certain aspects of the healthcare which has transformed in many ways and brought hope to many patients which otherwise may not have that privilege. The topic I'm going to talk is on bone tissue engineering, the dawn of a new era in medicine and organ replacement. As I said before, this started with a dream almost similar to that of the two young boys, like the Wright brothers, who had a dream to fly. They took risks, and then we realized 30 years later they founded the industry. And we have a dream to restore tissue to normality the natural way. I wanted to emphasize the fact that we are all growing old. And if you look at this statistic, in the year, perhaps presently, we have 9 or 10 young people supporting one elderly. But by the time we reach 2050, in which case we will be contributing to the statistics, less than 4 young people will be supporting one elderly. In fact, in Japan, it could be as low as 1 to 1. And if you look at life expectancy, the life expectancy, for example, in India, it is now very close to 70. And in Singapore, we are very close to that of Japan in terms of over 80. But when we look at the old age diseases, as we live longer, our body parts need replacement. We have mental illness, sensory impairments, cardiovascular, diabetes, cancer, incontinence, and last but not the least will be in the area of musculoskeletal problems. In the healthcare, we need to be focused. What are the challenging diseases that will affect 90% of populations? And if we take the growing world statistics, this is dawning upon us that if we do not, in Asia, put focus into the musculoskeletal problems, which is the main support structure of our body, then perhaps we will be lacking behind tremendously. I think it is important for us to realize that skeletal disorders can come from sports. Recently, I had a very close experience of my son who had that incident of a freak accident. The video that he shows, he broke his tibia while playing in a soccer match. Exactly what you have seen. And now we have seen the fact that skeletal disorders coming from sports has become a major concern. And not only that, I think we have to concern ourselves with osteoporosis, drastic drop in load-bearing capacity, and one then begin to ask ourselves, beyond bone grafting, the natural way, we still need to understand how do we improve the quality of our life as we move along. There has been some unnatural way to repair bone, the biological response of bone to stresses, and I want you to focus the fact that these problems did not arise immediately. For example, the stress shielding in the artificial hip prosthesis only revealed over time something like 12 years later, and you'll find the fact that bone loss due to the high stiffness of the stainless steel hip prosthesis has been a major concern. I'd like to share with you an example of the Wagner femoral component, which was introduced in the late 1970s. It came about with a very significant material science contribution because, yeah, we can put on a acetabular cup over the hip prosthesis, hip joint without removing it. But not after 9 years, we see tremendous problem in terms of all the cavities, and the history of the Wagner femoral component is already well established. I think over the years we have realized that as we age, when we pull out our teeth, although it may seem the fact that it is a common thing to just leave your teeth without an implant, but surely, and if we take a look at this picture here, we all like to look young, but you know, our bone may not allow us to look young if we do not take care of it. And by the time we realize that 1 inch of our jaw has resorbed, it is already too late because that process started perhaps 20 years ago. I think it is important, and I was very grateful to Professor Charles Vacanti. The Vacantis brothers are superb surgeons. He was the one who mentored our group in 1996, and he showed this video that you can actually grow cartilage outside the body, and when it has grown, you can put it back into the body. And that gives us tremendous hope that we can make use of our own cells. In this case, in my lab, we work with stem cells, which has high potential to proliferate into the organ that you so want. But I want to emphasize that in the area of tissue engineering, it is an area that integrates the life science and engineering. No single discipline can produce any breakthrough if not for the integration that we have so hope to do so. And I said just now in an earlier talk, I mentioned that the tissue engineering restoring tissue to normality the natural way consists of cells, your own cells, growth factors, and a resorbable scaffolds, so that we can have a means, a home. I would like to use it as a home for the cells to be trapped inside, and then they begin to multiply, produce the extracellular matrix, and then we can put it back into the defect when it is ready to do so. I like us to focus, and although some of you may not have much clinical background, I'd like you to focus on how bone heal. There are basically 4 stages. And the first phase in terms of inflammation, that phase is really to immobilize the fracture and activate cells. Cells will come in. And then the second phase in terms of callus formation, you have vessels formations, and then you move on to hard callus formation and bone remodeling. I think I want you to take note that this is a time-dependent phenomena, and it takes a lot of time. And we have already introduced scaffolds with clinicians who advise us the fact that, hey, look, we can mimic this healing process by stabilizing, say, with the intermedullary rod or nail with the scaffolds. And then we can then progressively see how the scaffolds, when they resorb, can promote the bone growth. At the same time, we can also introduce, because the scaffolds will begin to attract the cells, stem cells or growth factors, and then that could assist the formation of the right tissue and so on. In our lab, we realize that it is very important that we develop technology platform. Asia needs to develop technology platform. We need to be technology transformers. In the area of tissue engineering, organ tissue replacement, many of us think of the 4 modalities from biomaterials to scaffolds, cell work, and bioreactor. And I think in our university itself, we also focus on a very important component of bioreactor technology, which it is so important to mimic the physiologic conditions. But we, in my lab, we combine the 3 platforms, biomaterials, medical imaging, and scaffolds into one platform so that we can make use of medical technology, and with the medical technology, we can form the customized scaffold. I just want to very quickly look into the scaffold strategy, which I have said before. We create a scaffold that allows mechanoinduction for bone cells to remodel, and a scaffold that allows easy flow of nutrients and ways for cells to grow, and over time the scaffold dissolves, leaving no synthetic material behind. That is the part that we really appreciate a lot, because the material, when it degrades into carbon dioxide and water. One of the aspects which I have mentioned, and I want to repeat again, is this. In the innovations, in the creation of technology transformers in medical health, without regulatory approval, without the emphasis of getting all the ISOs in place. All that we can achieve will not benefit the patient because there are a lot of safety, a lot of efficacy involved. So I'm glad to be able to share with you the fact that one of the reasons of our success in so many applications is that we got early approval in the FDA. And some of the regulatory certificates goes beyond just getting the CE mark, but also in terms of the manufacturing and the clean room and so on. This has been shared recently to a group of neurosurgeons. And one of the effects that we wanted to establish in terms of a vessel promoting scaffold is to ensure the fact that the scaffold have enough porosity. And what we have shown in here is that even with or without growth factors, but eventually when you look at the vessel formation, it is an important part that tells us that, hey, look, in synthetic materials, non-degradable, such as titanium or stainless steel or the plastic polyethylene, they do not have the possibility at all to have this vessel-promoting effect, which is so important in the long-term results of the biocompatibility. And this work is a collaboration between our school at the time and with Georgia Tech and with clinicians. I wanted to quickly share with you some of our clinical work in view of time. I wanted to share the fact that indeed in the technological transformation, remember we can no longer work in silos where the biomaterials people work alone, the medical imaging work alone, and then you have the cell people working alone. We wanted to integrate. Inasmuch as being a transformer in technology, we also want to be technologies integrators. We integrate medical imaging. In this particular case, it's a case of a patient who fell down from a construction site, and we took his CT scan, we manufactured the scaffold to exactly fit it on. We seeded osteoblast cells because it's an end-stage trauma. The ethics committee only allows us to do on end-stage trauma. At that time, in the year 2003, we only could manage to seed about 300 million cells. We wish we could have seeded more. But it is important for us to realize the fact that the patients, as you can see, the cosmetic is really good. It is something that we have said to ourselves, if we are going to provide a technology, it has to be a technology that will be appealing to the patients as well in terms cosmetically. And I think we have achieved that. And in fact, we were so surprised that hair grew back. In fact, the hair, for your information, is one key way of helping us to identify, to see whether there's any toxicity. But in this first case, we did not have too much bone growth. I think we have only about 10 to 20%. The rest are fibroblast invasion. But the patient is well and happy and is able to work. And hair, of course, grew quite intensely. In fact, someone asked, does the scaffold promote hair growth? This is another topic I said perhaps if we can develop in the business model. But this case does prove to us, encourages us that when you have a large synthetic material that completely degrades, which is a new concept that we wanted to have, when it degrades, does it invoke a host of inflammatory response that will be detrimental? And the fact that it is more than 3 years, we felt very good and we developed more products. This is another case of a patient. She's 16 years old. When we first did it in Munich, we customized again a scaffold on the genetic defect on top of the skull. And this time around, we plug it in with a flange to immobilize. We realized the fact that as we move along in our research, the clinician says, hey, one of the things that you must remember when you have a large implant is to have prevention of micromotion. Then working with clinicians, I wanted to share this because it's so important. The clinician told us, hey, you know, we are concerned with the long-term results. And one of the long-term results is vascularization in the cranial. We need to put in the pericranial, which indeed the surgeons did it, and within 6 months, bone grew. And using that fact, in fact, this, as I said before, was one of the biggest cranial reconstruction in India. And Nikita is a fine lady. Both her parents died in an accident, but she survived, she suffered a large blood clot. She came to Dr. Sharan in Bangalore, and we were asked, can you help? I said, this would be a challenge, but we have had similar experience in Brazil before, so our team came together and we designed. Now, the design group consists of regulatory people, consists of engineers, consists of cell biologists, consists of clinicians. Eventually, we came to a design that was so good that Dr. Shah says, when you open it up during surgery, you cannot allow mistakes, misfit, that it fits so nicely that the surgery went completely well, and because of the knowledge that we need to have the pericranial in place, then we were so happy to take note that after 6 months, 60% bone growth. And in fact, I will be seeing her this afternoon to see how she's going after 1 year. But it is something that is delightful, and this can be a tremendous encouragement for those who are working in an area that will impact the lives of people, especially patients, who otherwise have no hope. Could you imagine when she wrote in the newspapers, after 4 years, I could go back to school without having to wear something over my head? This is another case which I want to share, a case of an old lady. She had a rotting syndrome on the anterior mandible that is between the left side and right side of the jaw. And Dr. Karl-Heinz wrote to me, can you help? And I remember him because he asked for a triangle scaffold which he wrapped it around the mandible, and then he put in growth factors, and then within 4 months, he could not believe it, bone grew. But then I said, maybe the bone that you grow is just stage 1 and stage 2. It is not hard enough. For those of us who work in bone, we know there are 4 stages of bone. So he says, well, let me show you the full data, which he did. He says, you know what? I put in 2 titanium implants. To put 2 titanium implants means that this bone must be at least in the late stage 2 or stage 3 in terms of the ability to take it. And we are so happy the 71-year-old lady do not have the possibility of losing her jaw, and she could now do her normal chewing function. This is another case that, again, the working with the surgeons in India, and I know that cleft palate restoration is a big one, and this is ongoing work, and we are now beginning to realize that there are more applications working with clinicians together with us. This is the last case I wanted to share. This is a case that Dr. Martin van Grinsven in Munich, Germany, asked for help. I met him in October in the Biomaterials Congress in Vienna. I said, Martin, why are you so happy today? He said, why shouldn't I be happy? The girl that you helped is now wanting to track the Alps in Austria. I said, do you mean the girl? I wanted to share this, and I felt the fact that this is so important, the integration of a few disciplines together. And in view of time, I don't want to go on to the other aspects, but I thought it is so important for all of us to realize that indeed, if we look into the healthcare whereby we can integrate and help each and everyone to understand the process, and I think if we understand the process, that will be superb, and I believe that will be a significant part in terms of our ability to transform the technology into something that will give hope. So I welcome you to Nanyang. This is my last slide. I thank you again for a time and opportunity that I can interact with you. Thank you so much.